All right, so we're going to talk today about the equivalent of if you lack knee extension, right? You can't walk well. Usually results in a limp. You're not getting that full extension of the knee, which is important for heel strike. And if you're not striking properly, you don't walk properly. You develop, compensatory gait and all that kind of thing. So we're going to talk about the equivalent for the jaw. So sometimes what will happen is you'll have your occlusion, which is your bite, your teeth coming together. The right side should come together and the left side equally. Well, sometimes one side won't make contact, okay? And so what you want to do is make sure that it makes contact. So I'm calling it's like lacking in full knee extension of the jaw. So the right side, say, is not making contact. So first we want to check. So the way to check to see if that quote unquote knee extension or that full occlusion is happening is we ask Amanda, open your mouth a little bit, close, and I want you to bite down on the tongue depressors, bite hard. So, okay, open again. Okay, yeah, let me see if I get it. Okay, bite down, yeah. All right, so bite hard. All right, so I'm pulling, she's full contact. I pull on this side, full contact, okay? So she has good bilateral occlusion. And you can also have the patient, and Amanda, I want you to kind of clap your jaw together like, yeah, and then ask them, do you feel it making contact on both sides? And you do, Amanda. Okay, so what we're gonna do is we're gonna kind of pretend that I put this in, bite down, and just bite on your left, but this side is moving around. So it's not making full contact. So we want to correct that. So if you lack knee extension, what would you do? Stretch the hamstring, loosen up the back of the knee, the origin of the gastroc and soleus. And so we're going to kind of do the same. So to stretch the hamstring or stretch this side to make sure that we have contact there is we do rest your jaw on here. We want to move the chin laterally to the left. So not the head, but just your chin. Go toward my finger. So relax, go kind of, let's wiggle. Yeah, there you go. And back to the center. Again, and back to the center. So when you go to the left, you're stretching this area, okay? And I might have them do it 6 times or so. And I will also do some intraoral release, the masseter, maybe with the thumb, the masseter in there. Might take my pinky up and get a little higher in the intraoral area. And amazingly, you do that and she'll bite down and she'll make full contact, okay? And it is that simple. So there are occasions when, say if you have a knee that's been lacking full extension for many years, it's more of a contracture, right? And that can happen with the jaw too. You can have a patient say, so it is important to ask them, what side do you chew on? Oh, I've chewed on my left side for years. And say, do you notice that if you don't make contact on the right? Oh yeah, that's been that way forever. Well, you can do all the stretching you want and it probably isn't going to change it that much, just like the knee. If you have a contracture, you're lacking knee extension for a long time, it's very difficult to get that back. All right, so wrapping it up, you always want to check, their bite. So you open, insert here, have them bite down, hold, don't let me pull you out, hold. Up this side, let's pretend it slides out. Up, it's not making contact, okay? So, might do some manual work inside. Masseter, a little bit of the pterygoid. And then we want to stretch, so we slide the chin to the left. And that's going to stretch this area because there's tightness in there, just like there's tightness of the hamstring and the gastroc. There's tightness of those muscles that cause it not to make contact. So when we do that, we check again, bite, and up, she makes contact. One last thing is the stretch becomes more aggressive when you stack tongue depressors. We're using 2, but if I put 6 on there and she goes to the left, it's going to stretch it more aggressively. So that's one thing. If you're not quite getting the result, you might want to do 3 or 4 on there. So naturally, just like if the knee is lacking extension, you manipulate the back of the knee, you do the hamstring stretch, and then of course you want to tell them, make sure you're stretching the hamstring, and teaching them too, behavior-wise, they're not used to eating on this side, to start to eat on the right side. Thank you, Amanda.